Liverpool Heart and Chest Hospital, NHS Foundation Trust. Information for patients. Liverpool Heart and Chest Hospital, NHS Foundation Trust, Thomas Drive, Liverpool, Merseyside, L14 3PE. Telephone 0151 228 1616. www.lhch.nhs.uk. This leaflet has been written to provide information about having a pacemaker generator changed. We hope it answers some of the questions or concerns you may have. It is not intended to replace talking with medical or nursing staff. Why do I need to have a pacemaker generator change? Your pacemaker's generator, often referred to as a box, is like any other battery and eventually needs to be replaced, although it can last up to 10 years. This will be identified during routine pacemaker checks. How is it done? You will normally be awake during the procedure, but you will be given a local anaesthetic to numb the skin. Sometimes, however, a general anaesthetic may be used. A small cut is made, usually above or below the original incision. The pacemaker's old generator, which is positioned underneath your skin, is replaced, usually leaving the original wires in place. The wound is closed using dissolvable stitches or a special type of glue. If your heart is dependent on your pacemaker to make it beat, you will be attached to an external pacing machine while the generator is changed. Will I feel any pain or discomfort during the procedure? Once the skin is numbed using local anaesthetic, it should not be painful. If you feel any pain, you should inform the staff. How long does it take? The procedure takes approximately 30 minutes. It does involve being admitted to hospital, usually as a day case. Fasting guidelines prior to your procedure. You will be instructed when to stop eating or drinking on your admission letter. It's most important to note that you should fast for the specific length of time stated in the letter, and not for a shorter or longer period of time. This is to ensure that you have a safe procedure. If you fast for too short a time, it may result in your procedure being postponed or cancelled. If you fast for a longer period of time, this may result in you becoming dehydrated, too little fluid in the body, which can lead to complications during or after your procedure. For example, if your letter asks you to fast from midnight, it is safe to eat and drink up to this time. Therefore, you can have a snack and a drink after your evening meal or before you go to bed. If you have any queries regarding the length of time you need to fast, please contact your consultant secretary. The number will be given on your admission letter. How do I prepare for the procedure? You may be invited to a pre-admission clinic prior to your admission date to prepare you for your procedure. Normally you will be admitted to hospital on the morning of the procedure. If you haven't already had investigations at a pre-admission clinic, you may need to have a heart tracing, ECG, and routine blood tests. Staff on the ward will prepare your chest for theatre using an antiseptic solution. What are the benefits of having the procedure? Having the pacemaker generator changed will enable your pacemaker to continue to work correctly. What are the risks involved? There is a small risk of bleeding and infection to the incision site. Wires leading from the pacemaker generator to the heart may occasionally become displaced during the procedure. Any risks involved in the procedure will be discussed in more detail before you sign a consent form. What alternatives do I have? All pacemaker generators will require a changing at some point to enable the pacemaker to continue to work. What can I expect after the procedure? Following the procedure, you will be taken back to the ward. You should restrict arm movement on the side that the pacemaker has been implanted. You will be able to eat and drink unless you require further tests. When can I resume normal activities? Most people go home later the same day. You will be given a new pacemaker registration card, which you must carry with you and show to any medical professionals that are treating you. You will not be able to drive for 1 week. If you drive a vehicle for which you need a special licence, LGV or PCV, you will not be able to drive for at least 6 weeks. Looking after your wound. You will be given important information on how to care for the wound after you leave hospital and what to do if you notice any redness, swelling or discharge from the pacemaker site. This advice will be discussed in more detail before you go home, and you will be given a discharge advice sheet. It's very important that you attend a pacemaker clinic for regular follow-up appointments. For further information, visit www.lhch.nhs.uk, www.nhsdirect.nhs.uk, www.bhf.org.uk, www.dipex.org, or contact the British Heart Foundation Heart Information Line on 0151 600 1636. If you require a copy of this leaflet in any other language or format, please contact us, quoting the leaflet and the language